We're excited to welcome everybody back to our office. It's been a couple months and, well, frankly, we've missed you. I'm sure everybody's been getting a little bit stir crazy, but it's so important that we've all been staying safe, but also sane. With that in mind, as we get ready to reopen Molen Orthodontics, there's been a few small changes that we want to walk you through in how the process will go for your appointments. These changes are being implemented to keep you safe and to keep the team safe, but also to give everybody peace of mind. For example, the night before your appointment, you're going to receive a text message. In that text message, you're going to find two things: a link to a questionnaire that just has a few simple screening questions that will allow us to make sure that there aren't any heightened risk factors for coronavirus. Also, there's going to be a phone number that we're going to have you text when you arrive in the parking lot. The parking lot's going to serve a little bit like the reception area now. Unfortunately, not quite as comfortable, though you will have your jams to listen to and air conditioning, so it's not all bad. But when you arrive, you'll text that number, and that's going to enter you into our virtual waiting queue. Once it's your turn for your appointment and the clinician is ready for you, we're going to text you back. When you receive that text message, feel free to come on in through the front door. When you walk in the front door, you'll be greeted by one of our friendly concierges. And they're going to, first of all, give you a squirt of hand sanitizer. Oh, thank you. After you get the hand sanitizer, we're going to give you a mask. Everybody in the office is going to be wearing a mask. Even if one of the children come in who aren't there for an appointment, we're going to kindly ask that they wear a mask as well. In addition, we're going to be taking your temperature. We're looking for a temperature of under 100.4 degrees or 38 degrees Celsius. That's what qualifies as a fever. If perchance you do have a temperature of 100.4 or above, we're going to ask you to reschedule your appointment for 2 weeks or beyond. Assuming that's not the case though, the clinician is also going to come to the front and meet you and take you straight back for your appointment. So for your visit, your first stop is going to be at the old toothbrushing station. Now it's going to be a rinsing station. There we're going to hand you a cup of Peroxyl, which is 1.5% hydrogen peroxide. Hydrogen peroxide has been shown to help break down viruses. And so the goal is to decrease the amount of virus that might be hiding inside of your mouth. That way, as we do the appointment, you're better protected and everybody else is better protected. Now, a few other changes that you're going to notice is when you get to the chair, it will have been wiped down completely before your arrival. There's going to be a few more masks, a few more glasses, and a few more things that will look extra, especially when we're using our hand pieces to remove glue from the teeth or polish the teeth before braces are placed. We're going to be wearing a face shield. It looks a little bit like a welding mask, not quite as large, but the goal there is to, again, offer additional protection. But it does look a little bit strange. Our clinicians will also be wearing gowns when they're doing those procedures. The gown might look a little bit different, but nothing to be scared of. So in addition to the clinicians wearing face shields when we're removing glue or polishing the teeth, you'll also notice a new device that we'll be using that helps reduce the amount of aerosol or spray that's produced. That way we'll be able to capture it before it's released into the air. So before your visit, make sure you use the restroom and brush your teeth, because unfortunately the restrooms and the toothbrushing station will be closed. In addition, sadly, the arcade is also going to be closed, and our massage room and play area. Hopefully those will be reopened soon, but for now, they're closed. So plan accordingly. So when your appointment is complete, we're going to be printing out appointment slips upon request only. So you can put it straight into your phone, or if you'd prefer, we're happy to print it out for you. Just let us know. When you get to the checkout desk, it's important that we maintain social distancing. So we need to ensure that we have that 6 feet between everybody. We're going to have marks on the ground to ensure that everybody knows exactly where those 6 feet are. As you're checking out, if you feel the need to use a pen, by all means, keep it. It's great marketing anyhow, right? So please keep those pens, no need to reuse those. Our ice cream station will be closed, but we will have an ice cream menu. So just let us know from the menu what ice cream you want, and we'll run back and get you a nice cold treat. Now, the same precautions that we'll be using as everyone arrives, taking temperature, asking questions, those same things are going to be done for everybody on the team, including the doctors. When everybody arrives in the morning, they're going to change out of their street clothes and into sterile, clean clothes. They're also going to be having their temperatures checked, those same questions asked, because it's important that we protect you from all sides. So when preparing for your appointment, please keep in mind that we'll only be able to allow one person in with each patient. Meaning that if you're an adult coming in for your appointment, then please, anyone that comes with you will need to remain in the car. Unless of course it's a small child, by all means, bring them with. In addition, if the patient coming in is a minor, they're welcome to have one of their parents come in with them or an older sibling or guardian. However, anybody else will again need to remain in the car. I can't tell you how excited we are to have you back. Of course, having a little bit of downtime, I think for everybody, was nice at the beginning, but everybody, including us, is antsy to get back to what we love to do. And what we love to do is create beautiful smiles for you and your family. We can't wait to see you here, and just remember that we want smiles to be contagious, not the virus.